My name is Nathan Ratchford, MD. I'm an OBGYN practicing at Phelps Health in Rolla, Missouri. I've been in the community for the past 13 years, and I'm happy to talk about infertility today. This is one of my favorite topics to cover with patients because not only is it common, but for most people it's relatively easy to test for, and there's treatments that are available to get patients the outcomes that they're looking for. Infertility is based off of factors that have to do with both medical conditions that are going on with the patient's age, and their history. I typically, when I'm seeing patients for infertility, tell them that infertility is defined as a couple that is having intercourse on a regular basis, at least once per month. They're not using any kind of contraception that would prevent pregnancy, and they do not successfully conceive in 12 months. Of course, fertility is going to change over the reproductive life of a woman. Typically, younger women in their 20s are going to have less issues with fertility than women that might be in their late 30s, early 40s. So generally speaking, if somebody thinks that they're having issues with fertility and they're older than 35, we encourage them to come in for evaluation sooner than we might somebody who's in her 20s or early 30s. Typically, we ask that they try it for 1 year before they seek out some evaluation. Infertility is actually pretty common. Again, it's age related, so for women that are in their 20s, typically infertility is somewhere around 5 to 10% of couples. Whereas if you look at women that are in their late 30s, early 40s, as many as 30 to 40% of those couples might experience infertility. Of course, if somebody thinks that there's something wrong, it's never wrong to seek out help and ask questions to your physician. Examples might be if somebody's periods become irregular, or if she's been pregnant before, it didn't take her that long to get pregnant, and now it is for whatever reason. There's a lot of chronic illnesses that people experience that might affect pregnancy. So obesity, high blood pressure, diabetes. If somebody's interested in fertility, I would certainly encourage them to come in sooner rather than later. A very typical scenario would be somebody who is in good health, them and their partner are interested in starting a family and getting pregnant. Maybe the female partner has been on birth control for a while. She decides it's time to stop it and try for pregnancy. I would typically tell somebody like that that they should try to get pregnant for 12 months, and if they do not have a positive pregnancy in that time, I would encourage them to come see me at that point. Yeah, so infertility is an interesting situation when it comes to healthcare because it's not affecting just one person. It's affecting both the patient and her partner. So you've got to take into account both the female as well as the male partner when it comes to infertility, evaluation, and treatment. These days, social media is really common. We've always had patients that are more open to their families than others. And it's a private issue for most people, so you kind of have to tailor to the situation. I would encourage people to be respectful of their family if they are seeking fertility evaluation. Stress can definitely play into the difficulty of getting pregnant, and that additional pressure is not good for anybody. So I would ask if you have a family member or a loved one that is looking to get pregnant, you're aware that they are having trouble getting pregnant, and they're seeking fertility testing evaluation, to be supportive. In addition to just keeping an overall good health, if you're somebody out there who you already recognize that maybe you're not as active as you should be, or maybe you're not eating as well as you should be, maybe it's something as simple as you're aware that your vaccines aren't up to date, for example. It's definitely best to try to address those health concerns before you get pregnant. So maybe that looks like starting a weight loss program. Maybe you need to see your primary care provider and make sure that your immunizations or your chronic health illnesses are up to date and they're managed as best they can be. It's certainly easier to take care of those things before you get pregnant. As far as moving forward beyond that, pretty much any reproductive age, sexually active woman, it's a good idea for her to keep track of her periods anyways, even if she's not trying to get pregnant, but even more so for somebody who is trying to get pregnant, because when she does conceive, that's going to be helpful information to help her obstetrician manage her pregnancy in a healthy way. But it's also going to be helpful in the evaluation if she doesn't get pregnant to kind of tell what's going on. There's a lot that you can learn about somebody's health from what her menstrual cycle looks like. Has it changed? Is it regular? That kind of stuff. In addition to those kind of things, I would just recommend that for most couples, especially like in the example I gave earlier where maybe it's an otherwise healthy couple, they're wanting to start a family, they're not sure if they're going to have fertility issues or not. You know, intimacy is an important part of a lot of couples' relationships, and unfortunately, if there's a perceived, potentially real issue that's preventing somebody from getting pregnant, that can really take away from that important part of their relationship. So I tell patients very frequently in the office when they come to see me for infertility, I tell them, you know, you're a young, healthy, happy couple. You should enjoy each other's company, be intimate like you normally would. For most people, even if they do have an underlying fertility issue, it's amazing how things just work out. You know, really try to have that normal, healthy relationship and leave the testing and the evaluation and things like that to doctors like me. Beyond that, if somebody really wants to work on fertility on her own, the menstrual calendar, you know, there's lots of apps in your phone and things like that you can do to keep track of your periods these days. They're actually really effective at predicting when you ovulate. So you can certainly follow that. And if you want to try to time intercourse around the time that you ovulate, it can't hurt. If you aren't interested in using an app, the typical person has a menstrual cycle that occurs about every 28 days. So what I tell people is if they really want to try to time intercourse to maximize their fertility, an easy way to remember is if your period starts and that's day 1, so keep on counting up, day 1, day 2, day 3, most women are going to ovulate around day 11 or so. So if you have intercourse on days 11, 13, 15, 17, and 19, so basically in the teens every other day, that is more than adequate. That may be too little, that may be too much for some couples. You're going to have to decide that yourselves, but if you want to time intercourse, that's appropriate. I think most people are aware that there's other options out there like basal body temperature charts, ovulation indicators. You can monitor your cervical mucus. I don't discourage people from doing those things. If a patient finds that information is helpful and if she finds it encouraging, it certainly doesn't take anything away from the testing. But by and large these days, those options are kind of antiquated. They don't really help people as much as we think that they used to. They're just additional information. And not that I have anything against ovulation indicators, but from talking to many patients over the years, I know that they can be expensive, they can be misleading. I think that for most couples that are trying to get pregnant, ovulation indicators probably are harmful more than they are actually helpful. So again, it's kind of one of those things that if you find it helpful, I wouldn't tell somebody not to do it. So when somebody comes in for a infertility consultation, like any consultation, the first thing it's going to start with is a good history. And I'm interested not only in my patient's history, but I'm going to want to know her partner's history as well. You know, what are their ages, what health conditions do they have, Do they have any problems with intercourse? Have they had any previous medical conditions or surgeries that might impact their fertility? Has she been pregnant before? If so, how did that pregnancy go? Does the male partner, does he have any kids, or has he gotten someone else pregnant before? That's all information that we go over. And I feel like I have a style in the office where I can talk about these delicate topics in a comfortable way as I can. But I just would caution people that, hey, unless you haven't realized it already, these are things that we talk about as part of that evaluation. So be prepared to answer those kind of questions. Definitely, I would hope that somebody is keeping track of their periods, and we'll go over what are her periods doing. That can tell you a lot about, is she ovulating, how well is she ovulating, those kind of things. And then after the history, then the focus starts more on the actual testing. So I tell people this all the time, it's not like I'm super protective of my patients necessarily, but for the female partner, her testing is somewhat invasive, so I always start with the male partner first. For whatever reason, some guys are kind of squeamish about a semen analysis, but for guys it's really easy to do the testing. It's not like what you might see in the movies. Most people around here, when they do a semen analysis, they collect the sample at home. It's very discreet. Nobody needs to know what you're doing. We give you the stuff to bring it in a bag. Basically, you bring it to the lab, you drop it off. Our lab is really good about getting results the next day. And we're looking at things like how much sperm is there, how well are they moving. I think we all remember from high school biology the little tadpole swimming things. The tech in the lab is looking at those kind of things. Do they look like normal sperm? If we've got a normal semen analysis, then the focus shifts on the female partner. If right off the bat, if we find that the semen analysis is abnormal, then I tend to refer patients to one of our urologists for further evaluation, because there's a lot of guys out there that think they're in good health, and then as part of an abnormal semen analysis, they find out that there's some other health condition that needs to be treated, and that's really important too. For the female partner, once the semen analysis is normal, then the focus on her is basically timed to certain points in her menstrual cycle. So again, if day 1 is the first day that she notices any bleeding, the first thing I do is on day 3, I get some blood tests for some hormones, specifically what's called a follicle stimulating hormone, FSH, and an estradiol, which is a type of estrogen. And those normal values give me an indication of, does she still have viable eggs? Do they appear to be working appropriately? Sometime between days 5 through 9, we'll typically do a special type of test in radiology where, using an x-ray, I'll do an exam kind of like a pelvic exam that most people are familiar with when they get a pap smear. But instead of just scraping cells off of your cervix like what we do with the pap smear, I take a little tiny catheter, it's a little flexible tube, and I thread that into the cervix in the opening. And then while the x-ray technician is taking a picture of the pelvis with the x-ray, there's a dye that shows up on the x-ray that we put up into the uterus, and it flows out into the tubes, and we can make sure that the uterus looks normal and the tubes are open. And then the last part of the evaluation for the female partner is typically on day 21 or 22, I'll do one more blood test for what's called progesterone. And for somebody who ovulated, typically about 10 days later after she ovulates, that progesterone will peak. And that tells me that she ovulated well, and in fact she did ovulate. Compared to the ovulation indicators that you might do over the counter, those don't actually tell you if you ovulated. Those actually test for a hormone that your pituitary and your brain makes, and that shows up in your urine. So somebody could still have a normal ovulation indicator from home, but then have a abnormal day 21 or 22 progesterone level. In addition to the evaluation that I listed, at Phelps Health, there's several things that we can do to help treat people for infertility issues. Unfortunately, sometimes there's things that we find that you have to go see an infertility specialist. Typically, there's a couple of doctors in Columbia and St. Louis that I use that are relatively close, but we don't have that service available here. But very commonly, if I have somebody with an abnormal semen analysis, our urologists here do a great job evaluating patients and treating that. A very common thing for patients is, especially if they're not having normal periods, they're not ovulating monthly like what we'd expect them to, there's medication that we can give for that. The three most common medications that I typically prescribe patients for fertility issues are progesterone, which is given to help regulate the menstrual cycle and make you have a monthly period. Metformin, which is actually, it's a medication that we give people for diabetes, but in my world we use it to decrease insulin resistance, which further helps decrease your testosterone level and it helps you ovulate better. And then there's also Clomid, which is a medication that you take in a pill form. The hormones that your pituitary makes to tell your ovaries when it's time to ovulate, it basically ramps up that production, so you're more likely to ovulate that month. These medications are all safe. They're very commonly given for fertility, but I would also caution people that they're not without potential side effects, and not everyone is appropriate to have these medications. So that's definitely a conversation you want to have with me or your doctor about if that's appropriate for you to be on that, would you benefit from it.